Bollywood entertainment, Bollywood gossip, Bollywood classics,
मुझको क्या हुआ है
to the latest hits,
मैं पानी पानी हो गई
local news and events happening around town, giveaways, and lots of musty. This is Namaste Radio. Every Saturday at 10 a.m. on 99.5 FM with your hosts, Vanchika, Sushil, and Sandeep. Listen online at namasteradiohouston.com. Download the app, available on your Android and iPhone. Namaste Radio.
Welcome to India House Houston. India House is a non-profit organization that serves the community by bringing resources, education, and services to Houstonians like health and fitness programs, language classes, charity clinic, and various events. Help the community now. Sponsor a program or volunteer for free food distribution at India House. Host your next indoor or outdoor events at India House facility, parties, weddings, or corporate events. Located centrally at 8888 West Belford, Houston. For details, call 713-929-1900 or visit indiahouseinc.org. Follow India House Houston on Facebook, Instagram, and Twitter. Good afternoon, everyone. Namaste, namaste. Welcome to Namaste Radio. This is a special show on mental health awareness in Asian Americans. My name is Vanshika Vipin, and I am here to talk about mental health awareness in Asian Americans. And with me today, handling all the technicalities, is Sandeep. Thank you, Sandeep, for doing this. And at the same time, I want to thank India House Houston, Hawk Foundation, and Asian American Health Coalition for sponsoring this show, this special show, and giving us the opportunity to do this show. This is the last show of this series, but we will definitely be back with more series. So stay tuned. We are here talking about mental health awareness in Asian Americans. We are on 99.5 FM. We are live on our Namaste Radio's Facebook page, and you can also listen to us on our app, Namaste Radio, our website, namasteradiohouston.com, or on Alexa. And now I would like to welcome our guest for today, Dr. Sneha Desai. Thank you so much for joining us today, Dr. Sneha. This is the second time, and we are honored to have you on our show. Thank you so much. Before I, talk to her a little bit about Dr. Sneha, she is a licensed clinical psychologist. Like I said, has been on our show before, and we had a very detailed and some amazing conversation with her last time. And I'm looking forward to this conversation this time as well. In her free time, other than her profession, she dabbles with storytelling on stage and the radio as well, and acts in short skits and films. Dr. Desai's little rescue dog, and we all know him, Koda, is a social media sensation and brings much joy to her and her husband on a daily basis. Welcome again. Namaste, Dr. Sneha. Thank you so much for joining us.
Thank you so much for having me.
So today, you have brought forward a very important topic, which is mental health in children. We talk about it, here and there, but today we're going to be talking about it in depth. So, to start with, tell us what is mental health, and specifically in children. What is it?
So, mental health in general talks about our social, cognitive, and emotional well being. So, obviously, all that sounds like jargon, but in like layman language, social is how do we act, right? Cognitive is how do we think, and emotional is how do we feel. And if all that is intact, then we have high mental health, right?
Mhm.
Or good mental health, I should say. It kind of refers to our ability to deal with daily stress. So if we don't have good mental health, then we're not going to be able to act socially, in an appropriate way or we will act in a poor way, we will feel bad, and we will also not have good thoughts. So, the higher the mental health, the better the mental health, the more socially, cognitively, and emotionally we are better.
Absolutely. No, thank you. That makes, like, the way you explained it makes so much more sense. And yes, pretty much everything we do gets affected for sure.
Mhm.
So yes, mental health, and as Dr. Sneha explained, that is so important. All parts of it. Now
Mhm.
today, since we are focusing on children, I would like to ask you: do children have mental health issues, and why is it important to think about that? Because a lot of times we feel, oh, I don't think children may have any issues in life, especially mental health. So tell us, why is it important to think about that?
So, when a child is born, we are so concerned about their health and the viruses that they're exposed to and the vaccinations that they receive and all of that. But as they get older and emotionally, as their brain develops and they start to perceive the world, they have a good understanding. They start experiencing emotions as well, and they have reactions too. You often see a child at Walmart throwing a tantrum because they didn't get a toy that they wanted, right? That is an emotional reaction to something that they thought would happen but didn't happen. So, a lot of times, I think that we are so focused on the physical development of the child that we forget about the emotional and the mental development. Yes, sometimes parents, or I would say most of the times, parents are concerned if they're developing cognitively, right? Do they have enough words? Do they respond a certain way? Are they, but a lot of people are forgetting about the emotional aspect.
Sure.
I had a friend who actually he has a 4-year-old daughter, and one time she was smiling for no reason, and I asked, "Why is she smiling?"
Mhm.
And he said, "Well, she's a child. Like she only feels happiness. She obviously always smiles." And I thought, no, that's not right. A child does experience anger, a child does experience sadness. The
Mhm.
good thing about children is that they're easily distracted. So,
Right.
when a child is angry about something and you point to something in the sky, especially when they're much younger, they get distracted and they forget about it. But if you don't do that, they may continue to be angry, right? So eventually, children also have to develop coping skills as they get into the world and start functioning in the world at schools and things like that.
Okay, so it is very important for us to keep a lookout for, how a child is behaving, reacting, emotionally. Because a lot of time, like you exactly said, that I've also seen people saying, "Oh, the speech is he's late on the speech, he's this that,"
Mhm.
but they're not focusing on how they are emotionally reacting. So,
Yeah.
um,
So imagine a child who's late on his speech development, right? He wants to be able to express himself. He wants to let the parents know what he wants or if he's hungry and he cannot. There is frustration building up there, but we are so focused on the speech that
mhm.
we forget about what frustration they may be experiencing.
Yeah, and that may leading to him, like, probably destructing more toys and acting, maybe in a,
Acting out, yeah,
yeah,
a lot.
yeah.
Mhm.
Absolutely. Wow. It makes more sense when you explain it so well. And at this point, I also want everybody who's listening to us, could be on 99.5 FM, or if you're watching us live on Facebook, if you want to participate, please come forward. If you're watching us live on Facebook, drop a comment. Dr. Sneha is going to be watching it. If there's a question for her, reach out. She That'll be, your feedback means a lot. And if you have something to share about this topic, we would really want that. So definitely on Namaste Radio's Facebook page, reach out, give us your feedback. And always remember, as she said, that have mental health issues do happen with kids, so it's important to keep a lookout for that. Now, what are some childhood disorders that children often have, but are not diagnosed or misdiagnosed?
So, children are capable of also having anxiety and depression, as surprising as it may sound, because we kind of think about these types of disorders as adult disorders.
Mm-hmm.
But children can have anxiety and depression. They just
Oh,
look
wow.
very different.
Mm-hmm.
So the manifestation of symptoms is very different in children. But apart from that, the more commonly diagnosed disorders in children are autism,
I see.
learning disabilities, ADHD, so attention deficit hyperactive disorder, which is very common. In fact, that I think is one of the most misdiagnosed.
Mm-hmm.
And I will get to that in a second. There's Tourette syndrome, which is not as common, but it's more to do with tics, involuntary movements. So, if a child keeps coughing or keeps like twitching his eye or something like that,
Mm-hmm.
sometimes there is no physical component to that, which
Mm-hmm.
could purely be psychological. There's part of the anxiety disorders is also obsessive compulsive disorders. And a lot of people like to joke about, oh, I have OCD because I can never see a frame that is, kind of angled a certain way, or I always have to have my counters clean. That's not OCD. That is not disrupting your daily life. OCD actually disrupts your life when you have to go back and check if all your lights are off 7 times before you get going. That is OCD. So a lot of kids have that too. And then there's post traumatic stress disorder. There are a lot of kids who are exposed to stressors that we may think are minor, but they react very poorly to them and they may end up being traumatized by it.
Mm-hmm.
So there are so many disorders that are emotional in nature, and I would say like autism, learning disabilities, ADHD, they are more neurological disorders.
Mm-hmm.
So they are slightly on a different spectrum. But going back to the ADHD, I feel like a lot of people think that ADHD is overly diagnosed, and it may be accurate. But there are overlapping symptoms between ADHD and anxiety. So, hyperactivity. If I'm anxious, I'm going to keep shaking my leg or twitching,
Mm-hmm.
but it may look like ADHD to somebody who doesn't know that the child is anxious, right? Or if I'm extremely worried about something, I may not be able to focus on what the teacher is saying. If I'm worried about where my next meal's coming from, or if my dad's going to beat me up when I get home,
Mm-hmm.
right? I'm not going to be able to focus on what the teacher is saying. So I may be distracted, but the teacher may think about that as inattention and may think the kid has ADHD, right?
Mm-hmm.
So there are many overlapping symptoms. So I hear people use these terms very loosely, like, oh, I have ADHD. No, if you have not been diagnosed, please don't use these terms loosely. Okay, always get diagnosed through a proper route, either a physician or a psychiatrist or a psychologist, but don't use these terms loosely,
Absolutely.
you know?
And it's we have been hearing this, talking to friends, and a lot of time. I think one of the main examples I can give is my friend said that their kid is just she thinks is just a lot of energy, and the school had to tell her to take him out of the school because they felt that something was wrong. So now, without
Mm-hmm.
being properly diagnosed, they came to their own conclusion, and probably they didn't want to take care of the kid, or class has too many kids, so the child felt very sad about it, and that
Mm-hmm.
kind of he felt, but they reached out to different school, and they felt he was completely normal. So yes, absolutely. A small instant or just one wrong or misdiagnosis can change a person's life, a kid's life, because I think then parents have to go through a proper channel, maybe go through medications, which probably sometimes may not be needed, right? Like if they are
Yeah,
misdiagnosed.
I don't think that that this is my principle, right? If a client comes to me, then medication is not the very first thing that I think about. I always think about trying to use other methods such as therapy, coaching the parents, management of symptoms. However, that being said, there are so many kids and adults as well, but we're talking about kids right now. They have gone hit rock bottom or gone so much below their baseline that therapy and coaching may not rapidly yield results. So we
Yeah.
have to put them on medication so that they can get to a certain point to be able to at least absorb the things that we are teaching them, and then we can gradually wean them off of medication.
Okay.
You know,
And when, sorry, go ahead.
no, you go ahead.
Okay. So, and when you ask these kids to take these medications, do you always see like immediate like acceptance? Okay, or is it always difficult to get the kids to get to a medication routine?
So again, I am not somebody who prescribes medication. I'm a psychologist, and in order to get medication, you would have to go to a psychiatrist.
I
The,
see. Okay.
the psychiatrist has a medical degree, and we have PhDs. But it the kid usually is not as resistant to the medication, right? Because they just do what their parents or the doctor tells them. It's usually the parents who are resistant, and rightfully so, because we don't know what effect is going to have. And it's after all, things that we're putting in the kid's body. But then I would say that if you've had a proper assessment, then please trust the professionals who are working with you, because I don't think that they would put them on medication just for the heck of it, if there is
Sure.
proper assessment.
Sure. And do you
Yeah.
see a lot of Indian kids reach out to you, like, parents getting their kids to you these days?
Yes, so I work at Sugarland Counseling Center, and for those who don't know, Sugarland is so highly populated with the South Asian community. So I would say at least 40% of my clients are South Asians.
Wow.
It's a mix of children and adults, but I would say 40% are South Asians, which makes me very happy in a way, because I know that the stigma is very high in our culture. And yet, parents have overcome that stigma problem and are reaching out for help because they know that they cannot do it on their own.
I see. Yes, and absolutely. And this show is kind of a part of it because we've always felt that, talking about mental health or reaching out to someone for mental health is always like a taboo in our South Asians. But,
Mm-hmm.
actually hearing this, I feel happy too that parents are taking that, or even adults are taking that step to come forward and take care of something that needs help at that time. And last time I know you did talk about the right people to reach, and why we did speak about why just talking to a family member is different from talking to a professional. So it's
Mm-hmm.
good that people are getting that awareness and reaching out. But
Mm-hmm.
thank you for sharing that number. I was wondering, like, are people reaching out, and especially in the Fort Bend County, and Sugar then of course comes under Fort Bend. I'm sure that number, wow. But I'm still a little surprised with that number because a lot of times people don't want to talk about it. But hey, as long as they're getting help, they're reaching out, that's good. So we are talking about mental health in children today. We are in conversation with Dr. Sneha. We were just discussing about some disorders that are sometimes diagnosed or misdiagnosed, and so now I want to ask her about what are some interventions used for it.
So it depends on the age of the child, right? If there is a very young child coming to me because they have been diagnosed with autism, or that's the very first professional that they're going to, then obviously the intervention is different as compared to a teenager coming to me. But for children very young, we often use play therapy. because kids very young are not able to communicate. I cannot expect a child to sit there for 55 minutes talking to me nonstop, right? So there are interventions, there is training that can occur in play therapy, that area. And so we use play therapy. Um, Obviously parents need a lot of coaching, right? Because if I'm intervening with the child, but if there are no changes happening at home or at the school, then the 1 hour meeting that I have with the child once a week is not effective.
True.
So when it comes to children, I spend a lot of times with the parents also trying to understand what is happening at home, what's happening at school, and what are some things that need to change, because sometimes it's purely a matter of change and the child reacts very differently,
Wow.
right?
Yeah. Yeah.
Um,
Absolutely.
Behavior therapy. So there is cognitive behavior therapy and then there's behavior therapy. Behavior therapy kind of relies on punishment and rewards, but lately in the past 20 years we are straying away from punishment and we are mostly using rewards, right? Reinforcement, positive reinforcement. So that's kind of training the child to behave a certain way without worrying about how they're feeling or thinking. We're just focusing on the behavior. And cognitive behavior therapy is helping the child to think differently about their situation so that their behavior also changes at the same time, right?
I
So
see.
these are very commonly used interventions with children. But again, like I said, it all depends on what problem they're coming in with and what age group they are in. So one size doesn't fit all.
And do you see kids with like who come there with some kind of issues after being going through some kind of abuse and stuff like that?
So at Sugarland Counseling Center, I have not seen a lot of those cases. I also think it has something to do with the demographic, right? With the type of population that lives in Sugarland. But in the past, I have worked
Hmm.
in settings where I have dealt with kids who are in foster care,
Hmm.
and kids who are in residential treatments, where, yes, they have been exposed to a lot of abuse and really traumatic events. Those kinds of cases obviously need a lot more intervention than just once a week therapy
Hmm.
or something like that. But yes, again, like I said, if that type of case is coming in, then the intervention is completely different. And also, I think I need to remind everyone that the mind and the body are often connected, right? So sometimes you can find a child is acting out in the classroom and getting very angry and distractible, but it's maybe all a matter of getting a physician's assessment, right? Maybe their eyesight is poor or there is something in their blood work that is
Sure.
lacking.
Hmm.
Maybe they have some hearing deficits. Maybe they are getting poor sleep. So
Hmm.
we want to make sure that everything else is ruled out before we jump to any kind of conclusions or diagnosis.
Absolutely. Yeah. And the reason why I specifically asked you about abuse was because while we were talking to Hawk Foundation or Asian American Health Coalition, one thing they wanted to know was about like physical or sexual abuse in a child in South Asians, because a lot of times just mental health, talking about mental health is a taboo. So this particular topic about sexual abuse or physical abuse in children is
Mm-hmm.
very sensitive when it comes to in our culture. So
Mm-hmm.
that is something they wanted to let the audience know, that if you're going through it, if something is there, please reach out. Let's not say theek hai, nahi nahi bhul jao, let it go, because that affects a child's entire life. And we've seen cases like that. We've seen people, so it's at this point, my personal request would be to any parent, because a lot of times these kind of abuse can happen even with family members at at home, or friends, or people around you that we know. So if there's something like this, please reach out, seek help, and don't try to hide something like this. Try to help the child. What do you have to say for something like that, Dr. Sneha?
I feel like there is a lot of shame, right, when it comes to sexual abuse or physical abuse. People are, especially in the South Asian culture, we are constantly worried about what other people are going to think, if it's going to bring shame to the family, all of that. I want to remind everyone, just like I said the very first time I was on the show, is that everything that you talk about with a therapist is confidential, right? However, that being said, if there is sexual abuse or physical abuse to a minor, disabled, or elderly person, then we as professionals, whether it's the doctor, the psychologist, the teacher, we have a duty to report that because we want to make sure that the kid is no longer exposed, or the disabled or elderly person is no longer exposed to that, that they can be put in a safe environment. So
Right.
if there is continuous abuse or if there is sexual abuse, then we will be reporting that because nobody who is in a position to abuse anyone who is below them in power and strength should be out there roaming around freely, causing harm to other people.
Absolutely, absolutely. No, thank you for sharing that. And again, I want to reach out everybody hearing us right now. Please, please, if you think this is something that someone is going through, or don't be quiet about it. Reach out and help that person, get them out of this situation. We are talking to Dr. Sneha Desai on a very important topic, mental health in children. Right now, I will be taking a short break, but stay tuned. We will be back. We have a lot more important stuff to discuss. So don't change that dial. Don't leave that Facebook Live right now. There's a lot more to discuss. So stay tuned, and we will be right back.
Let's go! Bollywood entertainment, Bollywood gossip, Bollywood classics,
मुझको क्या हुआ है
to the latest hits,
मैं पानी पानी हो गई
local news and events happening around town, giveaways, and lots of musty. This is Namaste Radio. Every Saturday at 10 a.m. on 99.5 FM with your hosts, Vanchika, Sushil, and Sandeep. Listen online at namasteradiohouston.com. Download the app, available on your Android and iPhone. Namaste Radio.
Welcome to India House Houston. India House is a non-profit organization that serves the community by bringing resources, education, and services to Houstonians like health and fitness programs, language classes, charity clinic, and various events. Help the community now. Sponsor a program or volunteer for free food distribution at India House. Host your next indoor or outdoor events at India House facility, parties, weddings, or corporate events. Located centrally at 8888 West Belford, Houston. For details, call 713-929-1900 or visit indiahouseinc.org. Follow India House Houston on Facebook, Instagram, and Twitter. Welcome back. You are listening to Namaste Radio. This is a special show on mental health awareness in Asian Americans. My name is Vanshika, and you are listening to us on 99.5 FM. And thank you for tuning in. If you're also watching us on our Namaste Radio's Facebook page, please feel free to give us your feedback, anything related to mental health, and we will be more than happy to listen to you, hear your feedback. I am in conversation with Dr. Sneha Desai. She's a licensed clinical psychologist, and today we are talking about mental health in children. We discussed a lot of, we spoke about lot about it in the previous segment, but now let's move forward and talk to her more about this. And my next question to you, Dr. Sneha, is that when should parents think about going to a clinician? Like, when is the right time? That's a very big question, and I think it takes some time for parents to decide that. Again, all of this is to do with the taboo that is connected with, oh, should I take my kid to a psychologist? What are people going to say?
Yes. So when is a good time? Any time is a good time, right? If you see any kind of deviation from normal behavior, there is no harm in calling a professional and getting their advice. If it is really nothing, if it is part of their development, if it is a part of life, the professional is going to tell you that and send you on your way. But if there is something going on, if it is the beginning of something, then the earlier we catch it, the better, right?
Mhm.
So no time is a bad time or no time is the right time. Any time is the right time. Remember, children are going through developmental milestones, emotional milestones. If they start to fall behind, then that is cause for concern, right? A lot of times people wait and say, no, like every child's different. It will pass, it will get better. Maybe it will. But what if it doesn't? Early intervention is very, very useful, right?
Right.
So, as soon as you see a deviation from the norm, go ahead. If you see the kid is not adapting well to a stressor, such as a change in a house, people move houses all the time. People move schools all the time. Maybe, a grandparent has now started living with them, or maybe a grandparent passed away. Like
Yeah.
there are so many different stressors. If the child is not adapting well, that means that there is a lack of coping skills, and they will definitely benefit from a professional trying to help them get through that and learn coping skills that they can generalize to other stressors in their life.
Absolutely. A lot of times, just divorce, like, if parents go through divorce and a child is pulled between that, and maybe not being able to live with both the parents, and now just being living with them separately, like, so that can also lead to a lot of, emotional imbalance, if I may call. Right?
So the thing that I would like to say there is that I have personally and professionally met a lot of Indian and South Asian couples just from the Indian subcontinent. I have met a lot of people who are very unhappy in their marriages, but refuse to end the marriage because there are children involved and they
Hmm.
don't want to put the kid through that. Um, I think that a kid will be able to adapt to a divorce, but the kid is not ever going to be able to adapt to their parents being unhappy and fighting all the time until they leave the home, right? So I have a lot of clients who are waiting until they turn 18 to leave the house because they no longer want to be part of the toxic environment,
I see.
you know. So
Hmm.
if parents want to divorce and they think that that is the right way to go for their personal emotional well-being, yes, will children struggle? Absolutely. It is a change, it is a huge change, but can they adapt? Yes. But being constantly exposed to the toxicity is worse than having to
Absolutely.
deal with their parents divorcing.
Absolutely. No, and thank you for bringing that topic up, because that is so true. A lot of times we settle for, that phrase that nahi bachcho ke liye we are together. We say that, right? So I've heard that so many times, and that is so true. Constant fighting, no love between parents, that family bonding. I think that can break a person or emotionally affect them more. So
Mm-hmm.
thank you. And this is something really important in our culture, that we
Mm-hmm.
they just want to stretch it. They don't want to leave, and I think it's because of the kids. But
Mm-hmm.
like you said, with proper intervention and proper care, the kids can definitely adapt. Now, do kids outgrow these issues when they, whatever issues they're coming to you for? Do they outgrow these issues?
They can. So again, it depends on the diagnosis. If you've been diagnosed with ADHD or autism or learning disabilities, these are neurotypical disorders. So there's something that you were born with, that this is the way your brain is. You
Mhm.
may not outgrow these issues. You will always have these, but therapy and other interventions will help you manage the symptoms better so that you can live a life that is absolutely super close to the normal, right? To the norm that you see around you. Um, can kids outgrow the issues of depression and anxiety? So I wouldn't use the word outgrow as much as can they heal from it. Yes, they can. Again, I think that intervention is needed. If people are expecting things to automatically go away, they're not, right? Just
Yeah.
like if we have some kind of medical disorder, do these things automatically go away? No, we have to go to the doctor sometimes, right? It's
Right.
the same thing with mental health. They don't just magically go away. We
Mhm.
can use band-aid approaches. I can say, yeah, I'm going to distract myself. I'm going to go listen to music. I'm going to go take a nap. I'm going to hang out with a friend and I'll feel better. Yes, you will. But that is a band-aid approach. You wake up the next day and the problem is still there,
Sure. Yeah.
right? So we need interventions. We need skills and methods to deal with things that are being thrown at us every day.
Absolutely.
So it's the same thing with children, right? Yeah. With children, I would say that a team approach is the best. Like you always want to work with the parents, you always want to work with the teachers and the physician and whoever, because um, the kid may be acting out at school but not at home,
Yeah.
right? Why? Is that a setting problem, or is it more to do with the child himself or herself? Right?
Hmm.
So if there's a problem in the setting, we need to fix the setting. Obviously, we need to teach the child how to deal with it, but if the setting is problematic, we also want to work on that.
Absolutely. And a lot of times, I think, I've heard this from my mom since she's a teacher. She says that parents are like, oh, oh, he's behaving so well here, but at home, he's a devil. And mom's like, yeah, he's absolutely fine here. But I guess that's what it is. And changing the setting, they probably need to not, I don't know, I don't have kids yet, so I can't really say, but I know one thing. I am a dog mom, so having, I think the same thing applies to dogs. Like if you send them for some kind of training, it's always good to train us as well as parents, as dog parents, because um, we may still be doing this wrong setting, we may still be doing the wrong commands, but I need to learn the commands what they are learning from the trainer. So I guess it's kind of something like that, that when someone's reaching out for help for a human, of course having all the parents around, and like Dr. Sneha said, like a group approach, that's the way, having everything set up. So I'm just trying to connect with my personal experience here, and
So,
I know
so
you
you're
yourself
right.
are
You're
right,
right.
right?
I think that what you're referring to is, how I told you about behavior therapy a few minutes ago.
Yeah.
So, the techniques that we use with animals when we train animals is behavior therapy. When a dog does something right, we
Hmm.
give them a treat, or we say good boy or good girl,
Yeah.
right? And that makes them understand that this is a behavior that I need to repeat because this is applauded, this is appreciated. So they do that more and they forget about the problematic behavior. If the child is throwing a tantrum in Walmart, if I don't pay attention to them, eventually they realize this is not going to get me attention. But if I walk around like a good girl or a good boy, I may get an extra toy that I could purchase today, right? So that is
Absolutely.
behavior therapy. So yeah, I think that a lot of those concepts are comparable, but again, animals don't have the cognition like human
Sure.
beings do. So
Yeah.
then we also introduce the cognitive part in therapy.
Absolutely.
And when I was talking about interventions, I should have also mentioned another good intervention to use with children and
Hmm.
teenagers is group therapy. Um, a lot of kids still don't understand the concept of mental health. They feel like the problems that they're experiencing are purely and solely related to them. But a lot of those problems are very common, right? Such as anxiety in social situations, or, being anxious before a test or something like that. So when we bring all these people together in a group format, they learn so much from each other. They learn to support each other, and they feel so validated because they know that they're not alone. And that in itself is so healing. So,
Wow.
group therapy is also definitely something that I would ask parents to consider when they're thinking about therapy for their children.
Wow, wonderful, wonderful. Thank you for sharing that. Now, what are some issues that South Asians children in particular face here in the US?
So, personally, from working with all the South Asian families that I've worked with, a lot of them, a lot of my clients are second generation immigrants, which means that their parents were immigrants, right? So the parents have a very different way of raising the children compared to the American population. So with that, like when it comes to, let's say, dating, right, in the teen population, or taking a date to homecoming, which we just had like a few weeks ago in most of the schools around here, um, it is a big no-no. And so these kids are kind of wanting to fit in with the majority population, but are being so torn apart because their parents are putting rules on them which don't necessarily apply to the majority population. Also, a lot of parents, I think, have a hard time understanding what their kids are being exposed to and kind of being more flexible. A lot of the immigrants are caught in a time warp because they are thinking about raising their children the way they were raised. And they
Right.
may be liberal, but they're not liberal to the point that they fit the norm. So, a lot of these second immigration kids are struggling with that aspect, right? And then the second thing is, just like any minority, I think that there is some bullying. A lot of kids, maybe not in Sugarland as much, because I would say that those schools have a lot of Indian and Asian and South Asian students there.
Right.
But if you are minority, if you're going to a primarily white school or white and black school, you are going to be minority, and there may be bullying, especially at the elementary school level, because you look so different, right? And kids don't understand, kids don't have a filter, and so that can have a huge impact on the child.
Absolutely.
The way they perceive themselves, the way their self-esteem develops, all
Yeah.
of that. So I think that um, parents and everyone should just be a little bit more cognizant of that, and not just poo poo the idea that, oh, it's just kids being kids.
Right. Probably talk to them and hear them out at what level it's kind of affecting them, right?
Hmm. And when it comes to the rules of parenting and stuff, I think that they may want to like come to a midway point, not just my way is the highway, right?
Yeah.
But you don't necessarily have to listen to the kids and give them all the freedom if you're not comfortable, but you don't necessarily have to be stuck in this time warp either.
Sure, and I think one very important it's a mindset that we've had since you said parents grew up properly, and if just talking about Indian parents, they grew up here, now their kids are growing up here. I think one thing was between a boy and a girl. It was easy for a boy to stay out a little longer, but the girls had to be back home at a certain time while growing up back in India, probably. Here, I think things change, but then, like you said, that mindset also sometimes bothered kids here. And I mean, I've seen it with friends around whose kids are growing up, are teenagers. So, um, again, like Dr. Sneha has been discussing all these things, the reason why we are talking about all this is because these are things to think about. And if you feel this is something that you are going through, or you feel your daughter or your son may be going through, you feel, and you have any feedback, or you want to get in touch with Dr. Sneha, talk to her about it, please reach out. She will be sharing her number very soon. So definitely reach out to her. But now, before, we have about 10 minutes left for the show. One thing I want to ask her is, why is it okay to see a therapist even if there is no diagnosis or any kind of emotional issue? And I know this was something that you wanted to share, because again, the same thing in our culture, we feel seeing a therapist or seeing a doctor for any mental health related issue is always a taboo. So we want to get out of that thought process, and that's why this very important question.
So, not everything has to be clinical in nature, right? So, we don't have to have a clinical problem in order to see a therapist. Just this past weekend, one of my friends contacted me, and she has an 11-year-old who is gifted and talented.
I
And
see.
she wants me to recommend some therapists for him because she wants to know how to communicate with him better, right? So, to be gifted and talented is such a matter of pride in the South Asian community because we really value intelligence and high grades and all of that. And my doctoral dissertation was on the emotional and social needs of gifted children because they are so intelligent, their needs are also very different.
Yeah.
Sometimes they don't feel like they fit in with the norm. They feel like people don't understand what they're saying. Their interests are very high level that their peers may not necessarily share with them. They
Yeah.
get frustrated easily in the classroom because the classroom curriculum is designed towards the normal, the average child, right? So kids
Right.
who are behind with ADHD and learning disabilities obviously suffer, but gifted children also suffer because they understand the concept in the first 10 minutes. So, why do they have to sit there for the next 20 minutes and twiddle their thumbs or get punished for staring at the wall, right? Because that
Yeah.
can happen too.
Hmm.
So there are certain issues which may not be clinical, but if your child's acting out, just go find out from a professional what
Yeah.
is going on, you know? Um, like I said, early intervention is the best intervention. You don't want your kid to be suffering for 2 years and then you find out that, something's wrong or they need medication or things could have been prevented a really long time ago. There is no harm in going and seeing somebody. Like I said, if there is no problem, we will send you away. I just had a new client yesterday and I talked to him for an hour and then I told him I really don't know how to proceed with you because this is not a clinical issue. You can talk to me for coping skills sometimes, but really it is not disrupting his life in any way. But he
Right.
wanted to make sure he's okay. And I feel very proud of him for doing that, to pick up the phone, call somebody, and take that first step.
Absolutely. And that
Yeah.
is the most important thing, taking that first step, right?
Mhm.
And today you also mentioned about, somebody having, okay, compulsion disorder. And, because Sandeep and I usually joke with each other. He thinks I have OCD of doing everything right. And I keep telling him, you make fun of me, but, you know, that is just me. And then some, and it's funny that he himself has that, so we both actually make fun of each other, that that's your OCD of, like, even if it's putting a show together, putting it so right. But when you actually said, it's really mind boggling what you said, because coming back home 7 times just thinking that did I switch off the light or not, that can really be, I mean, the level it must be affecting in a person's life. So
Mhm.
these are really important things to think about. These are
Mhm.
very important to consider, and that's why reaching out talking to someone, reaching out to a professional is very very important. And one thing Dr. Sneha, when she was here last time also and today also, she always has told us that talk to a professional about it, because that's the right way, that's the right approach. In like she also mentioned, if there's nothing, just pick up pick up your phone, reach out. If there's nothing, she'll let you know there's nothing, go home, have fun. But if she finds there's something, she'll definitely talk to you, take care of you. So at this point, before I ask Dr. Sneha about her details, I want to thank India House Houston for giving us this opportunity, and also share their details, so that if you want to reach out to India House Houston for the different free classes that they offer, you can always reach out to them for that. The number to reach out is 713 929 1900, and the website is India House Inc. Inc. That's indiahouseinc.org. And they do have relationship coaching consultation by Deepthi Patel. It's free of cost. So you can also reach out at the same number. Again, it's indiahouseinc.org, and the number is 713 929 1900. And we also want to thank Asian American Health Coalition, Hope Clinic for sponsoring this, Hog Foundation for sponsoring this. And at Hope Clinic, if you want to reach out to their behavior department, the number is 713 773 0803, extension 196 or 258. Now, Dr. Sneha, if you can share about your clinic and how they can reach out to you.
So I work at Sugarland Counseling Center. The website is www.sugarlandcounseling.com. There are a lot of therapists over there. It's not just me. There are plenty of therapists there. So, and everyone's bio is on their website. So, if you feel like you want to read up on everyone's bio and experience and all of that, that if that makes people more comfortable, then definitely do that before calling the office. The number to call is 832-876-3232 to make an appointment, or to have any questions that you have. Just ask them about insurance, payments, etc. I would like to add that Sugarland Counseling Center has two groups running. One is for high school students, and the other one is for middle school students. That is going to start next month. The high school student group is already running. It has been, I think, it's been running for the last 2 months, if not more. I would say it's running for a little bit more than that, but you can join the group at any point, right? It's an ongoing group. And so if individual therapy is a bit overwhelming at the beginning, then start with group therapy, and then you can move on to individual. If you want to do both at the same time, you're welcome to do both at the same time too.
Perfect. And that's Sugarland Counseling Center. And can you?
Sugarlandcounseling.com.
Okay.
It is Sugarland Counseling Center in Sugarland.
And can you give the number one more time?
Sure. It's 832-876-3232.
Perfect. Thank you so much. And thank you so much for talking to us, Dr. Sneha. Is there anything you would like to add before we let you go today?
Well, obviously, I want to thank you for having me on the show. I think that the mental health issues in South Asian population is very, very important to discuss, because of the stigma that has existed for such a long time. So
Yeah.
I just want to be an advocate, and I just want to make sure that everyone knows that there is nothing to be ashamed about and nothing to be embarrassed or scared about. Everything is always confidential. No one's going to find out about it. So please take that first step, make that phone call for your benefit, because mental health is as important as physical health.
Absolutely. Thank you. Thank you so much. And we want to thank you, all of us here at Namaste. We want to thank you for always coming forward and sharing with us such insights on this very important topic. This is the second time and definitely not the last time. We always enjoy talking to you with all those details. And next time when we have you on our show, we'll definitely discuss another topic. But at this point, we also want to thank India House Houston for partnering with us and giving us this opportunity. They have, put that faith in us, and this was the third time we came up with this. But hopefully, in the next 2 months, we'll have our next series on mental health very soon. And also, Hawk Foundation and Asian American Health Coalition. Thank you so much for sponsoring this. A special shout out to Anila Khan and special shout out to Colonel Vipin Kumar, the Executive Director of India House Houston. Thank you, Sandeep, for all your technical help. Thank you so much. And stay tuned. This is the end of this series, but we will be back with our Namaste Radio show next Saturday, November 6th at 10 a.m. And till then, stay safe and happy Diwali from all of us to you all. And happy Diwali to you, Dr. Sneha.
Thank you. Same to you.
Thank you. Thank you so much. Namaste, everyone. Thank you.